My name is Robin. I'm from Owens Community College here in Findlay, Ohio. Today we're going to be demonstrating a Foley insertion with sterile technique. We will demonstrate two of them. We'll start off with a female. Okay, so we'll get started. The first thing that I would do is review my orders to see exactly what needs to be done. And then I would make sure that there's no history of the patient with any urinary strictures or any prostate issues to begin with. Okay, I'm going to go ahead and go over here and I'm going to wash my hands. I'm going to come in and introduce myself to the patient. Hello Donna, my name is Robin. Could you go ahead and verify your name and birth date?
Yes, it's Donna Cruiser 000000.
All right, thank you very much. Do you have any allergies other than the penicillin that I saw, especially to tape, latex, or shellfish?
No other allergies.
Okay, well I am your nurse today that's going to be taking care of you today, and the doctor has ordered for a Foley catheter to be inserted, and all that is a little tube that we're going to put up into your bladder so that we can drain that urine out for you, okay? And hopefully you'll have a little bit of less discomfort at that time. There shouldn't be any pain. There might be a little bit of pressure, but as we proceed, you just let me know if it's hurting you, okay?
Okay.
All right, we'll get started. I am going to gather my equipment. I'm going to go ahead and clean off the table, position it as needed, and position my patient. You can use additional towels or blankets or whatever you may need if the patient is cold, just to keep them warm. I'm going to apply clean gloves. We're going to go ahead and make sure that the bed is locked as well. I'm going to have that side rail up on the opposite side that I'm not working on for safety. We've provided for privacy. And we're going to put this blue pad down just in case we get a little excess water down there. And while I'm cleaning her up, I'm going to visualize the meatus. So I'm going to wash outside, get a clean part of the washcloth. The inside, get a clean part of the washcloth, and we're going to go down the middle. And then I'm going to go ahead and rinse the washcloth, and we're going to do this process again. Okay, and then we're going to go ahead and pat her dry. These supplies away. I'm going to remove these gloves. Okay. I'm going to wash my hands. All right, now we're going to go ahead and prepare our kit here. Put this over here, and I'm going to raise the bed to a proper height for me. Should be somewhere around waist high, which that's probably a little low, but that's good for my reach, I think. Table will raise up just a little bit. Alright, this plastic bag I'm going to use as my garbage can. And I'm going to go ahead and place that right there. This I'll save for the end so that I know what to document. Alright. Now we need to open the outer flap first, but I'm going to turn it just a little bit so that I end up with a square. So I'm going to do the outer flap. We're going to do a side, side, and down in front of me. Okay? I'm going to grab first bottom drape, just grabbing it by the 1-inch borders. Okay, the shiny side goes down. And you don't want to cross back over it, so bring your hands up and around. Never losing sight of my sterile peel. I'm going to go ahead and put my gloves on. I like to step off to the side so that I make sure I don't cross over my first glove. I pick it up and back up. Okay. All right, now I'm sterile. Now I can pick up my fenestrated drape and I can touch that anywhere now that I've got sterile gloves on. All right, and this one, bring down and around. Okay, now I'm going to prepare my kit. I'm going to move this off to the side, being careful not to go over my 1-inch borders. I'm going to open up my betadine. I'm going to sprinkle that all over my cotton balls. Throw that away. I'm going to squirt my lube in there. Throw that away. I'm going to separate my boxes now so that I can work from the inside. Okay. All right. So being careful again not to cross over, I'm going to grab my water soluble for my balloon. I'm going to connect that. I'm going to place that back in the box. Okay. I'm going to grab the catheter piece of it. And you want to try to curl this up in your hand if you can so that it doesn't flop all over the place. Put that in there. I'm going to bring that over here, put it in the loop, and tuck it back nicely into the box. I'm going to go ahead and put this top part back on there. Pick up the box and get that out of my way. And transfer it over to the patient. All right. Now I'm going to commit this hand to be dirty, so once I put this on the patient, I don't let go, okay? So I'm going to go ahead and spread the labia. I'm going to grab my cotton ball. We're going to take one. We're going to go down the outside, throw it away. We're going to go down the inside, throw it away. Go down the middle and throw it away. Now if you've got extras, you can take another one down the middle if you want to, but okay, now I'm just going to remove of this box over here. Okay, all right, at this time, I'm going to break sterility here for a second so I can get this sprayed. Okay, all right. Now I'm going to ask this patient to bear down while we start to insert this catheter. You want to insert it without touching. This one's being a little bit stubborn. There we go. All right, so for the female, what we're going to do is insert it until you see urine, and then we're going to go 2 to 3 inches more. Okay? So we've done that. We're going to go ahead and grab 1 inch away. I'm going to inflate the balloon, and at the same time, I'm going to ask the patient if they're having any discomfort while I'm doing this. Now, without letting the fluid go back into the syringe, you hang on to that. We're going to pull on the catheter, make sure it's in place, and then you can let go to disconnect your syringe. Okay, so we didn't lose any fluid there. Okay, so now we're going to go ahead and clean up this patient At this time we would rip this off and throw it away, but we're going to leave it there for right now. I'm going to remove these gloves. I'm going to put my clean gloves back on. Well, I'm going to wash my hands first. Let's wash my hands. I'm going to put some clean gloves back on. Okay. And then, got my stabilizer. Remove this box, and then we would put our stabilizer on the leg right here. You're just going to use a little bit of a, leave it a little bit loose so that it's not pulling on the patient, okay? And then I would hang this bag on a sturdy part of the bed that is not moving. You want to make sure there's no dependent loops. And that it's below the bladder. Okay, now I got that part done. I'm going to remove my clean gloves at this time. I'm going to go ahead and wash my hands again. And then we're going to go ahead and put the patient back down. I would take care of all of my trash. Make sure that they are in a comfortable position. Make sure they have their call light. And then I am going to document the date, the time, the procedure, the size of the catheter, the size of the balloon that I inflated, the color, clarity, and amount of the urine. And I believe that's the end of the sterile technique of a Foley insertion.